Introduce
Okay,
kita sendiri.
we are recording.
So hello everyone. We're from COVID-19 team or crew, and my name is Intan Nirmaya Sari. I'm grade 10 from Advisory J.
I am Irgi from 10H.
And my name is Dayan. I'm grade 10 Advisory C.
Ariel from grade 10 Advisory A.
My name is Kevin, grade 10 from Advisory B.
So today we're going to present about COVID-19, and the first one is introduction. The COVID-19 pandemic has been the worst pandemic ever hit within the 21st century. COVID-19 starts in December 2019 in Wuhan, China. It is mainly spreads via an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe heavily.
And thus is the problems from the global impact of COVID-19 pandemic. COVID made by most countries in the world as a non-natural national disaster that has an impact on public anxiety, worry, and fear of the threat of health problems due to infected COVID-19 and even the threat of life, where millions of people have the potential to be infected. A lockdown policy has been implemented by several countries as an effort to prevent the spread of disease. Public health emergencies are happening around the world, and which includes school and work vacations. Restrictions on other activities shall be concluded also.
So the dangers of COVID-19. Most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have angst and pains, nasal congestion, runny nose, sore throat, and sore throat. The dangers of this virus, how easily spreadable it is. This could harm those with disabilities, elderly, or undeveloped immune system, fatality, and harder to eradicate it fastly and efficiently.
Story about COVID-19. It's starting from December 2019. The number of COVID-19 cases in Hubei gradually increased, reaching 60 by 20 December and at least 266 by 31 December. Gradually, it spreads to Italy, Iran, South Korea, and Japan, then finally the world, and the United States being the lead on most cases as of 26 March 2020.
COVID-19 attacks the respiratory systems. Thus, it can cause minor disturbance, severe lung infections, and death. This virus can also cause severe respiratory infection, such as lung infection or pneumonia. This virus is transmitted through sputum droplets from the respiratory tract. For example, when it in a crowded, closed room with poor air circulation or direct contact with droplets. Those make it feared and dangerous.
And the effect health problems became social, economic, and political problems, COVID-19 has impact on social and economic problems in society, where some people lose income, are unable to work to meet the minimum needs of life, especially poor and vulnerable households and the informal sector. People are unable to do business activities and are impaired, which has the potential to further worsen economic conditions. The most vulnerable are manufacturing, trade, transportations, and accommodations or restaurants and hotels.
Present day. Currently, on December of 2020, there are about more than 64.5 million cases that has been reported worldwide due to COVID-19. More than 1.49 million have died, and more than 41.4 million have been recovered. Thankfully, a vaccine is on trial, and some countries even certifying it, but not widespread for the public.
For the prevention of the COVID-19, we need to measure to reduce the chance of infection include staying at home, wearing a mask in public, avoiding crowded places, washing hands with soap and water often and for at least 20 seconds, practicing good respiratory hygiene, and avoiding touching the eyes, nose, or mouth with unwashed hands.
Solutions to prevent COVID-19. Currently, what we can do is that to spread the awareness of this virus, active preventive action, and also take part on saving life, on taking your part and break the chain.
So the opportunities are Education and Culture Minister Nadiem Makarim has said the government already devised a new education roadmap to realize President Jokowi Widodo vision to make Indonesia developed country in 2045 prior to the paramedics, which would entail a systemic reform that was expected to transform the widely accepted notion of uh, curriculum, as well as to improve the quality of teachers.
The threat and warning, the threat of this virus is very dangerous because it has spread throughout the world. Therefore, we must maintain personal hygiene in order to prevent the coronavirus because this is one of the biggest threats in the world.
As a conclusion, COVID-19 and 2020 has us on our knees, but that makes us united for the cause of good. COVID-19 being one of the worst outbreaks out there, being highly dangerous and spreadable, we can only break the chains and help out others socially distance until the vaccine is out.
So that's all from us. That's all from our group. Thank you for listening and thank you for your time. And see you next time. Thank you.
Goodbye.